How do cultural differences affect virtual healthcare communication? Imagine trying to have a meaningful conversation with someone from a completely different background through a screen. It can be challenging, right? That's because cultural differences play a big role in how we communicate, especially in virtual healthcare settings. When you talk to a doctor or mental health therapist online, your cultural background influences how you understand health, illness, and treatment. It also affects how providers interpret your words and nonverbal cues. Language barriers are one of the biggest hurdles. Patients might not speak the same language as their provider, making it hard to explain symptoms clearly. Telehealth makes it easier to connect with providers who speak your language or understand your culture. Using simple words and avoiding medical jargon helps ensure everyone is on the same page. Nonverbal cues like gestures or eye contact can also differ across cultures. Some cultures see direct contact as respectful, while others might find it intrusive. Providers need to be aware of these differences and ask about communication preferences. Health beliefs are another key factor. Some cultures may see illness as a spiritual issue or prefer traditional remedies over Western medicine. When providers respect these beliefs, they can build trust and work with patients to create treatment plans that fit their values. For example, understanding that some patients might be hesitant about mental health therapy due to stigma can help providers approach conversations more sensitively. Technology access varies too. In some communities, especially rural or low-income areas, people might not have high-speed internet or be comfortable using digital devices. Providers should ask about technology familiarity and offer support, like guiding patients through the platform or offering phone calls instead of video if needed. This helps make telehealth more accessible for everyone. Cultural competence in telehealth platforms is also important. Some systems lack features for patients with hearing or vision impairments or don't include culturally relevant health information. Adding these features and hiring bilingual staff can improve communication. Telehealth allows connecting patients with providers who understand their cultural context, which is especially helpful for mental health care and remote patient monitoring. When cultural differences aren't addressed, patients may feel misunderstood or uncomfortable, leading to less trust and poorer health results. On the other hand, culturally sensitive communication makes patients feel heard and respected, boosting their engagement and satisfaction. This is especially true for mental health services, where cultural norms and stigma can influence whether someone seeks help. To set up telehealth appointments with cultural differences in mind, providers should ask about language preferences and arrange interpreters if needed. They should also check how comfortable patients are with technology and give clear instructions. Discussing health beliefs openly and respectfully can make a big difference. Choosing telehealth platforms that support different communication modes and accessibility features helps ensure everyone can participate comfortably. Also, scheduling appointments at times that suit cultural or family needs shows respect for patients' routines. In the end, cultural differences shape how people communicate virtually about their health. Telehealth's flexibility and ability to connect patients with culturally matched providers help overcome many barriers. When providers understand and respect these differences, the patient experience improves and care becomes more effective for diverse populations.